Good evening, respected Minister K.T. Ramarao and all the other dignitaries on and off the days. Thank you very much for having invited me to attend BioAsia 2018. I remember with a great deal of joy the one that I came to last year. I attended BioAsia 2017. So I really am sorry that I'm not able to be with you today, and I hope that this short message that I'm sending makes sense to the wonderful people who are attending this meeting. I know the breadth and depth of experience and wisdom that is present at this conference, and amazing things can come out of this mix. As you know, the world has become one market with respect to health products in particular. And we have manufacturing hubs emerging in many developed as well as low and middle income countries. And India is a good example of this, and particularly the state where you are. There are also many new health products funding and procurement mechanisms, which are both global as well as regional and in the country level. And this is making access to health products a reality for millions of people who didn't have that before. However, the production and control of medical products requires a high degree of regulatory oversight. As commented by Dr. Brundtland, former Director General of WHO, drugs are a public good and not simply just another commodity. First, for their high social value, and then because consumers and prescribers are unable to assess their quality, safety, and efficacy. So while medical products are essential to the attainment of health, consequences of poor quality products, whether they are drugs or vaccines or diagnostics, can have serious consequences. And that's where WHO plays an important role, and other regulatory agencies play a very important role. Production of medicines, devices, vaccines, diagnostics, and other health products is a complex business, particularly now with an increasingly global and fragmented production and supply chain. Quality cannot be assured in products. It requires an end-to-end approach that considers all inputs and processes, that operates with a robust quality management system and a secure supply chain. WHO's recent report on the socioeconomic consequences of substandard and falsified medical products highlighted the risks of weak supply chains and procurement systems, with an estimated incidence of 1 in 10 medical products being either substandard or falsified in low and middle income countries. So effective production and supply chain oversight requires a competent and well-trained workforce across regulatory functions, laboratory testing, and most of all requires good governance. At the same time, it is important to note that over 30% of the 194 WHO member states, predominantly in low and middle income countries, have insufficient capacity to perform core regulatory functions. And this is a big concern for us, and there are various ways in which we are trying to address this core regulatory capacity. Promoting access to quality assured medical products is a key objective for WHO, underpinned by numerous World Health Assembly resolutions, and in fact is now a target in the Sustainable Development Goal 3, which speaks of access to quality assured medicines and health products and functioning regulatory systems. WHO contributes to this objective through the setting of international norms and standards, regulatory system strengthening, efforts to combat substandard and falsified products, and the pre-qualification program. WHO works with the national regulatory authorities of member states and other partners to address the gaps in regulatory systems. We also, as you know, develop the essential medicines list, which is absolutely critical for countries when they develop their own essential medicines list and procurement policies. And we're also now working on an essential diagnostics list that would try to delineate the kind of diagnostics that are very critical for good primary health care. So collaboration, reliance, and risk-based way of regulation throughout the product's life cycle is important. And the global benchmarking tool developed by WHO is a key tool in this regard, which systematically focuses capacity building efforts based on impact and need, and also in promoting efficiencies. Priorities include leading global exporting countries like India and regional manufacturing hubs like the one here in low and middle income countries, as well as countries transitioning from donor funded central procurement to more local procurement. So this work also requires a collaboration and application of unified standards to assure quality products for everybody and reduce barriers to their access. One of the best success stories in ensuring access to quality assured medicines and vaccines, now worth over about $3.5 billion, is the WHO pre-qualification program. The WHO Collaborative Registration Procedure, or CRP, through accelerating local registration, has demonstrated that reliance on these mechanisms can facilitate access to these critically needed products. And finally, WHO is playing a leading role working with other UN agencies and partners in assisting countries interested in building local production. And this work involves the development of tools and strategies aimed at strengthening regulatory oversight, because that ultimately will lead to quality assured products. I'm sure that at this conference, there will be a lot of discussion on biotechnology, on frontier areas where advances are being made, on products, on devices, and a lot of it is going to be very critical for the future of the health of the population of all the different countries that are represented here. So in that way, I think our goals are similar. We want to improve the health of millions of people, which is also a commitment to the Sustainable Development Goals. And I think hubs like the one that's being created, bringing together people, bringing together capacities, having enlightened policies so that local production can flourish, trying to innovate more and support local innovations, but ultimately with an aim to have a quality assured product that can do well in an internationally competitive environment, while at the same time keeping the cost affordable, I think is really the mantra and the key, the frugal innovation that Indian entrepreneurs are particularly good at. I would like to once again apologize for not being there in person, but I'm certainly there with you in spirit, and I wish the conference all success. Namaskar.